Hello, my name is Jennifer Campbell. I'm an Auburn University nurse practitioner student. Today I will be presenting my 5-minute video on Bell's palsy. So for an overview and definition, Bell's palsy is also known as acute peripheral facial palsy. Bell's palsy has no known cause but can occur at any age of life. This condition is believed to be a result of swelling and inflammation of the nerve that controls the muscles on one side of the face. Other causes are believed to be a reaction that occurs after an infection. For most individuals, Bell's palsy is temporary. Symptoms usually start to improve within the first few weeks and recover completely by 6 months. In some very rare cases, some symptoms occur for life. Rarely, Bell's palsy can reoccur in patients. In Bell's palsy, the nerve that controls facial muscles, cranial nerve 7, becomes inflamed and swollen. The nerves also affect the tears, saliva, taste, and the small bones in the middle ear. So some causes. Although the exact cause of Bell's palsy is unknown, it's often related to a viral infection. Viruses that have been linked to Bell's palsy include the herpes simplex virus, herpes zoster, the Epstein-Barr virus, adenovirus, rubella, mumps, influenza B, and the virus that causes hand, foot, and mouth disease. So who's at risk? Bell's palsy affects over 40,000 people in the United States each year. Higher incidences occur between ages 15 to 45. Patients that are at risk include pregnant women, especially in their 3rd trimester, or women who are postpartum in the 1st week after giving birth. Others that are at risk are pregnant women who are suffering from preeclampsia, those who have upper respiratory infections, and then also patients with diabetes, hypertension, and obesity. So 3 essential questions to ask and why. First, have you had any symptoms of a more generalized infection? As a practitioner and as a provider, we're looking to see if there's any infections that could include the influenza B, Epstein-Barr virus, the herpes viruses. We're looking to see if there's any infection that has previously occurred that may be resulting in the Bell's palsy and the facial paralysis, the unilateral facial paralysis. Another question would be, have any of your relatives ever had Bell's palsy before or a problem with facial paralysis? Although not specifically known, Bell's palsy does have a link to it to run in family and be genetic. Another question to ask is, has the following diagnosis been ruled out? Other symptoms of facial paralysis can be associated with brain tumors, stroke, myasthenia gravis, and Lyme's disease. So as a provider, we need to assess for those first and rule all of them out before we assume that the patient does have Bell's palsy. So describe the top 3 physical examination components. A diagnosis of Bell's palsy is made based on the clinical presentation. So first, we would assess for rapid onset of mild weakness to total paralysis on one side of the face. Typically, the rapid occurrence occurs between 48 to 72 hours. In most cases, weaknesses occur on the upper and the lower portion of the facial muscles. We also want to notice for any facial drooping or difficulty making facial expressions. And then another physical examination component would be the inability to close eyes, which is resulting in the irritation and dryness of the eyes. Typically, since it's unilateral, it will be one eye that's just completely staying open at all times. So for an overview of the most common treatments for this diagnosis with expected outcomes. So most will recover with or without treatment. Commonly used medications include, first, the corticosteroids, reducing swelling of the facial nerve. And typically, we want to begin these corticosteroids beginning within 72 hours of onset. And we also sometimes will see antiviral drugs, such as the valcyclovir and acyclovir, given in addition to the corticosteroids in those with severe Bell's palsy. second treatment plan is to protect the eyes that can't close by using lubricant eye drops during the day and eye ointments at night. We want them to take over-the-counter pain relievers for comfort and then use massage and exercise the face with physical therapy. Other components of treatment do include the physical therapy, the facial massage, and acupuncture, which provides a potential improvement in the facial functioning and pain. So three teaching priority components that must be addressed with the patient to manage this diagnosis. First, eye protection is an important teaching component because Bell's palsy can interrupt the eye's blinking ability, leaving the eye open and exposed. We want to keep the eye moist and protect it from injury, which can include sometimes wearing goggles. Lubricant eye drops and eye patches are very effective in these patients. 85% of cases spontaneously resolve within 3 weeks. And some individuals may be left with mild residual facial weakness and show moderate to severe deficits. That's where the physical therapy and massage can come into place. Some individuals do suffer from involuntary mouth movement when trying to blink the eye or incomplete recovery of facial muscles resulting in trouble speaking, which may result in the patient needing some speech therapy.